So a lot of them revolved around the different categories. I think there's tremendous confusion as to, what is a service dog, what is an emotional support animal, and what is a therapy animal. So we spent a lot of time separating out what those different categories were, what the different legal requirements were around those categories. The other set of questions were from a veterinarian's perspective is really what was, if a veterinarian is not going to be prescribing or certifying these animals, what is their role in their care, and their role really, as I mentioned, in an ideal world is partnering with their medical health counterparts, the physicians or psychologists or psychiatrists, to ideally determine if the animal has the right temperament, to determine if it's in suitable health, and to sort of map out a care program or protocol to allow that animal to function optimally in its role. Increasingly, it's starting to happen. I think with a lot of the confusion, veterinarians were uncertain as to what they could and couldn't do. And as you'll appreciate, because in many instances you're dealing with people with various disabilities, we've got to be very careful with how we address questions. We've got to be very careful with how we approach the exam from a legal perspective. You don't want to be you don't want to come across as being discriminatory with things like charging additional fees or prying into their medical records. So one of the questions that came up was what can be noted in the medical records. And as I mentioned, intuitively think as a veterinarian we treat pet, so we make notes about the pet's health in our records, not about the owner's health in our records. The other question that came up was how should veterinarians be reaching out to their medical health counterparts? And absolutely, one of the activities that the AVMA has tasked with, other than advocacy and sort of defining a variety of policies for these animals, is specifically in setting up some working groups, bringing together human health associations and the various veterinary associations to provide sort of more distinct protocols and guidelines for both the human side and the veterinary side for the management of these animals.